Hi, I'm Dr. Sheri Weinstein, and I have a practice called Sarasota Wellness and Internal Medicine. I'm located in Sarasota, Florida. We practice everything from regenerative medicine with bioidentical hormone management, detoxification strategies, weight loss, and other therapies for prevention, as well as internal medicine and adult medicine. I have a beautiful practice. I'm very blessed. I have limited my practice from my initial practice of 3,000 patients down to a maximum of 300 patients, and it's what's referred to as a concierge type practice. An average visit is anywhere between, say, 45 minutes and 2 hours. It depends on what the patient needs. My comprehensive executive physical examination is performed once a year, and this is head to toe, eyes, ears, nose, throat, dermatoscopic evaluations, all kinds of other assessments. And based on those findings on the physical exam, I can then ascertain if they need to have additional diagnostic testing, such as vascular testing, ultrasounds, echocardiograms, stress tests, spirometry, all of these things which can be performed in our office setting. We see that so many of the medical problems in today's internal medicine can be rooted back to just a few functional issues. And some of these are functional deficiencies with either nutrients or with hormones. Toxicities are huge. Mitochondrial issues are huge. And obesity or diabesity, which is becoming it is an epidemic in this country. So a lot of these issues, if you get back to the basics of what's going on at a basic level, you can take care of a broad spectrum of disease processes by treating the underlying pathology. You know, obesity is epidemic in this country, and no one individual is identical to another. There are so many different causes for obesity. Oftentimes it can't be put back to just, you've got too much caloric intake as compared to your caloric expenditure. There can be underlying hormonal imbalances, nutritional imbalances that can contribute to that. Stress, sleep issues, environmental exposures, it's all related. So there's no one-size-fits-all program for weight loss. We are using things such as HCG. I use products such as Medifast. I'm using other products, Metagenics and Zymogen and other nutraceutical products. But even those, you need to be selective about who gets what, because not every product is correct for each individual. One of the most rewarding things that I deal with in my practice is taking patients who have come to me from other practices and have been given diagnoses of fibromyalgia and chronic fatigue syndromes and some of these autoimmune disorders where they've had other doctors throw their hands up and have not found treatments that have helped them. And they've even been put on things like chemotherapy through rheumatologists, and that has made them feel worse. When they come to me and we're doing the diagnostic testing and laboratory testing, etc., and finding out what really is going wrong, and we get to the root of that by giving them nutritional supplementation, IV therapies, etc., and having them change their lives where their fibromyalgia is gone, their chronic fatigue syndrome is gone, their chronic pain syndrome's gone. My biggest source of referrals is my patient population, and I have patients ranging in age from 13 to 105, which is my oldest patient, and she's alive and well and doing beautifully, living independently. And I do a lot of gerontology living in Sarasota, where the average age tends to be over 65. Certainly we work from the inside out as far as helping patients to look their very best. But certainly having some of the newest and most proven regimens for skincare and for beautification, including some of the neuromodulators and filler applications, otherwise neuromodulators being Botox and fillers such as Juvederm, Bellaterra, Radiesse, etc. These are also a very good part of our practice for patients that just want to really help to undo some of the damage that they may have sustained in years of sun exposure and maybe not so healthy living. If you'd like more information, I invite you to go to my website at sarasotadr.com And if you've already been to the website, you can certainly call the office at 941-366-4422, and any one of my helpful staff could answer your questions. You're welcome to make an appointment for an office visit or a consultation.